Hey everyone, it's Eric Fierro with MedicareBest.com. I'm coming to you guys live today and I want to go over a couple of things. So tomorrow is November 1st. So for everybody who's in Medicare, you've heard of something called the annual election period. That runs from October 15th through December 7th. Okay, so this time frame, October 15th through December 7th, is the time where people who have Medicare Advantage plans and people who have prescription drug plans get to make a change from one plan to the next. So if you have Medicare Advantage, you can choose to go to another Medicare Advantage plan with a different insurance carrier, or you could choose to go back to original Medicare so that you could try to qualify for a Medicare supplement. For people who have Medicare supplements and original Medicare, that during the annual election period, they can move from the original Medicare and Medicare supplement to a Medicare Advantage plan. For those who have Medicare supplements with a separate prescription drug plan, they can move from one drug plan to another drug plan during the annual election period, which again is from October 15th through December 7th. Not to be confused with the annual election period for the Affordable Care Act. You see, that's where a lot of confusion starts to come in because, first of all, a lot of people actually are confusing Affordable Care Act plan, or also known as Obamacare, with Medicare, Medicare Advantage, and Medicare supplement options. They're two different things, two whole different systems. The Affordable Care Act was designed for people who are under the age of 65 and who are not on Medicare, because there are a few people who are on Medicare under the age of 65 due to disability. But for the majority of people that are under 65, that are not part of a group health insurance plan, they were given access to the Affordable Care Act marketplace. And so when you're under 65, you have the option to look at plans from November 1st through December 15th for Affordable Care Act option plans. Okay, so I want to make that clear distinction. Even though you have the annual election period used in both the underage 65 market and in the Medicare market, there is a difference in the time frame, and there's also a difference in the type of coverage that you're looking at. So with that being said, as of right now, it is the October 31st. So we are now about 15 days into the annual election period for Medicare Advantage plans and for prescription drug plans. So you still have about another month and 7 days to make your decision on which way you're going to go. If you have a Medicare Advantage plan and you want to see if there's another one that could benefit you better, that has better co-payments and deductibles and co-insurance, or even additional benefits, this is the time to talk to your Medicare specialist to see what's available out there. If, on the other hand, you are somebody who has a supplement plan, then this is the time where, if you want to go to an Advantage plan, this is the time to talk to a specialist to see what Advantage plans are available to you. And if you also are somebody who has a Medicare supplement but also has a prescription drug plan, this is the time where you check and see if there's other prescription drug plans that might offer you lower co-payments or lower deductibles, or sometimes you get put in a position where your prescription drug wasn't covered anymore during the year. So this is the time where you look for a new prescription drug plan that will cover all the prescription drugs you currently take so that you are the best covered for your situation. So for all that, to say that you have till December 7th to make the decision. You don't want to wait till the last minute to make these decisions because things take time depending on your position, depending on what you currently have insurance-wise. So my recommendation is that in the month of November, this is the time that you want to be talking to your specialist. Medicare Best is here exactly for that reason. We actually have offices in 4 different locations across the United States to better serve your needs. That way we are in the Eastern time zone, in the Central time zone, and in the Western time zone, so that you can still always reach somebody basically from 8 a.m. Eastern till 8 p.m. Eastern, 5 days a week. And we can take you by appointment on Saturdays as well, or Sundays. You would just need to let us know. But our phone number is 877-317-2259. We're always available to talk and answer any questions because so many people get confused about Affordable Care Act plans and Medicare plans. They think they're one and the same. They think that these election periods are the same thing. They are not the same thing. They are different, absolutely different. So what we do is we specialize in educating our consumers, our clients, on the difference in the Medicare Advantage plans, Medicare Supplement plans, and also your Affordable Care Act plans. Affordable Care Acts are actually a lot more people are having to look at that because many times we have clients who the spouse turns 65, is eligible for Medicare, no longer is going to have group insurance, but as a result their spouse loses group insurance. The younger spouse who is not Medicare eligible yet loses group insurance, and so they're looking at the Affordable Care Act as their only option, which you're going to see that unless you have a certain level of income, you're not going to receive a subsidy for Affordable Care Act plans. And in those situations, when you're looking at premiums that are $800 to $1,000 a month, plus you still have a $6,500 to $7,500 deductible to meet, it can be really painful. So there are alternatives out there. So if you have that spouse in the house who also needs to look at something until they become Medicare eligible, we can help with that as well. But mainly, I just want to again stress, there is a difference. So the enrollment period that you need to be concerned about if you are on Medicare is the October 15th through December 7th enrollment period time. So during that time, if you have a Medicare Advantage plan, you can move to another Advantage plan or back to original Medicare. And people with Medicare supplements, if you want to consider a Medicare Advantage plan, this is the time to do it as well. So if you have any further questions, like I said, we have a large team ready to help, ready to answer questions. Our service team is here to help and answer questions. We've been doing this. I've been licensed since 2004. We've been helping thousands of clients every year to navigate this crazy Medicare jungle to make it so much easier. And if you guys ever have any questions too, I want to start doing more of these live streams so that during the live streams, when we have more people participating and more people viewing, you can always answer questions right here on the screen and I'll be happy to answer them. So for now, I just wanted to make that clear distinction about the differences between Affordable Care Act and Medicare so that you guys are aware. And if you have any other questions, feel free to let me know. We'll see you guys on the next live stream. Take care.